Welcome back, everybody. My name is Dr. Khan Kao, and welcome to the YouTube channel. Today, I am joined by Dr. A.R. Abd-El-Barr, uh, and welcome.
Thanks,
Uh,
Con. Thanks for having me.
so he's a practicing board certified urologist. He's been practicing for 4 years, and today he'll be talking to us about what's like being a urologist, and hopefully students can learn a thing or two from him, and maybe want to become a urologist. All right. So AR, can you briefly describe to us your path to becoming a urologist, and also a brief job description of what does a urologist do?
Yeah. Well, thanks for having me on. I really appreciate doing this series. I think it's super helpful to medical students or even pre-med students, especially for some of these like niche specialties like urology that if they don't encounter it before medical school, it may not be a core elective, it may not be a core rotation in their clinical years, and they may not learn that much about it or consider it as a career choice. And it's a very amazing career choice for some people if it, the shoe fits. So I think it's awesome that you're doing this to expose people. I personally was never exposed to urology or pediatric urology before medical school and before my clinical years, and I kind of like lucked into it. I feel like I was kind of like it was like this hidden treasure, and I discovered it, and I'm like, whoa, that's definitely what I want to do. Uh, and luckily enough, it was early enough in 30 year that I could, because it's an early match, so I could get all my ducks in a row and apply for that specialty. So I think it's good to be exposed earlier for those that you know because it's also getting more and more competitive. I don't think I could match into urology these days. Um, I don't think I get into medical school these days. I feel like it's so much more competitive now. So getting ahead of the game and knowing what you want to do, I think will set you up for success career wise. Um, thanks again. And what rambled on, I forgot your question. How do you get into urology?
Yeah. So just describe your path to urology, which you kind of did,
Yeah,
and then the job description. You mean?
yeah, yeah. So to take it back a little, kind of a non-traditional medical, pre-medical student. I have a background in biomedical engineering, and I went to grad school for biomedical engineering before I decided I want to go to med school. I had this engineering background in tissue engineering, and I was always kind of science oriented and engineering oriented. Um, and when I was in medical school, I saw all these amazing, uh, preclinical sciences, um, and I was always fascinated by like fluids and acid-base balance and the way the kidneys work, but also was fascinated by surgery and anatomy and kind of like being able to learn a little bit about all different body types and kind of being a jack of all trades. And then I have been into actually a pediatric urology elective very early in my third year. It was kind of a lottery system at my medical school.
Hmm.
And I was like, oh my God, these pediatric urologists get to do surgery, they get to see patients in clinic, they get to prescribe medicines, they need to be cognizant of the medical milieu of the patient and their acid base status and their fluid status, and they need to integrate all this into their clinical decision making.
Hmm.
But they also get to do surgery, so not just technicians, but they kind of get to be jack of all trades, and they get to play with a lot of toys like robot surgery and
Yeah.
scopes and all these fun things. So it's almost like it's going to work is kind of like a fun new thing every day. So that was very appealing to me. So I did an elective in pediatric urology, fell in love with it very early on in third year, and luckily it was early enough to get ducks in a row and apply for urology. It was an early match, so to do at that point, third year had already started, but I moved up some of my electives to urology, which I hadn't planned doing, an adult urology elective, and then do some urology aways. I ended up having to like actually push some of my electives to fourth year,
Wow.
which ended up being okay. And then and then applied to urology in the early match, which by the end of third year, and people are kind of figuring out what's going on, you kind of really need to know what you're doing and have shown up to elective, you know, surgeries that you need to be in, or signed up for a research project or something like that. And so, like I said, I think, you know, in today's highly competitive world, it really helps to get a jump start and probably know before third year starts that urology is something that interests you. But luckily, I learned about urology and became interested in it right at the beginning of third year, which was enough time for me to get my patient in.
Okay. Okay.
Then you do, you know, it's an early match, but the internship is integrated. So as long as you match into urology, your first year general surgery um, internship will be integrated with that. So you just formally have to apply through the national match process for that, but it's already guaranteed once you get into the early match urology.
Uh,
Um, so that you end up doing a year of general surgery at the same institution, um, and then 4 years of urology, and that can be, you know, plus or minus some months because you're going to do some urology in your first year. And I think most programs are shifting away from the old, it used to be 6 years at a lot of programs. There's
mm,
only a few programs that I know of, and I've been out for a few years, so that there may be none now, but that
wow.
are still 6 years where you do up to 2 years of general surgery before you start doing urology. Um, but generally a 5 year residency, in which you're being exposed to a whole variety of subspecialties, including my subspecialty, which is pediatric urology.
Hmm.
Um, do a lot of, you know, oncology, fetal urology, trauma,
Mm,
general urology. And so you get a whole bunch of experience of these various specialties in your 5 years. And then you have the option of doing fellowship, of which there are several different choices in urology. They feel like there's different strokes for different folks in urology. It's such a
yeah.
wide system that some people do, you know, want to focus on oncology and cancers of the GU tract, to focus on, you know, BPH and prostate problems. Some of them want to focus on trauma, focus on female and their urologic issues, focus on
Mhm.
kids and their urologic issues. So there's a whole wide variety of different fellowships, range from 1 to 3 years.
Mhm.
Um, After the residency.
Mhm.
Mine is really pretty much because kids, as you know, are not small adults, and
Mm,
their urologic issues are not miniature urologic issues of adults. They're often very different. They're often congenital.
mhm.
Um, so they are things that they're born with, which is they're very different than the lifelong urologic care of adults, which are diseases that happen in the older population and happen more to men. But there are it's very specialized. But you do, you know, to get there, you have to do a whole, you know, very strong basis in all the urologic care of all sorts of patients before you get the specialized in kids. In my case,
Okay. That's a great breadth of urology that I personally wouldn't know, and I can't
yeah,
imagine a medical student would know all that that the depth of it.
correct, yeah,
That's awesome. Thank you for that. Um, so, just thinking back to your medical school days, it seems like you were able to realize that you wanted to do urology very early, and that's one of your advice to have students if they know they want to do urology or just trying to figure out. Um, were you considering other specialties, and do you have any advice for students who are interested in urology, to how would they know to jumpstart that early ship?
yeah. Yeah, I mean, I was definitely interested in several other fields that were similar to um, urology in terms of they involve some surgical care,
Hmm.
of some medical care. Um, you know, they involve, you know, focusing on one body part and how that integrates with other systems. So things like ENT appealed to me,
Hmm.
orthopedics appealed to me, neurosurgery appealed to me. So, and then also radiology and interventional radiology
Hmm.
appealed to me. I feel like, especially IR, it's very like cutting edge and
Hmm.
interventional, but you also need to know a lot about the body, how
Hmm.
it's working. So there's a bunch of different uh, fields similar to you, I feel like, that kind of fall um, into that same kind of uh, I don't know what the
Realm.
word I'm looking for, in the same realm of
Yeah.
procedural, but also medical specialties.
Mm.
And then, but and for me personally, you know, I just like that the medical knowledge urologist needs seems to be uh, a little bit more than what you need to do surgery, head and neck surgery, right?
Mhm.
Head and neck surgery, not so worried about the fluid status of the patient or the acid base status, or what medication are there. I'm kind of, I'm exaggerating, but
Yeah. Yeah.
I feel
Yeah.
like urology really you need to be more cognizant of those factors.
Mm.
Same thing with the orthopedic and so forth. So that's why urology of those kind of won out.
Cool. Cool. So you chose urology, distinguishing it from the other aspect because you liked the functionality of the medicine aspect on top of
Yeah,
the procedure aspect of it. Uh, That's
exactly.
awesome. That's awesome. And I mean, you talked about how competitive the field is. I personally don't think I would match into emergency medicine either nowadays. I was sorry. So what advice do you give to students on how to be competitive in urology now that step one is not, it's pass fail now?
Yeah. Yeah, I mean, I think it's super competitive, and I like to joke that, yeah, my residency program, they took 3 residents 1 year and 2 residents another year, and luckily I applied in the year they took three, because I'm sure I was the third resident because my two co-residents were stellar. So I was
Hmm.
like, I'm sure I was the third one, and it's only because it was a year that they took three that I ever
Yeah.
got into it. So definitely fortunate. It's very competitive these days, and it seems like people are applying have very distinguished themselves with a lot of research, a lot of uh, well thought out reasons why they want to go into urology, right? I think that it's not just to get your name on some publications. That definitely shows that you're hardworking and industrious and intelligent and resourceful. Those are important characteristics. But um, showing that you've put some thought into why you want to be a urologist, and why that appeals to you, and why you think um, that you'd make a good urologist. And so that doesn't necessarily mean that your research projects have to be in urology. You could have started off with some basic science research that has nothing to do with urology, and then as time went on, kind of refined that and got into more specific things.
Hmm.
But I think there's definitely um, you want your application to show a very strong interest in the field. And so that involves research, clinical exposure, volunteering. And a urologist at the end of the day is a very well-rounded surgeon
Hmm.
and physician, because, like I said, they need to be aware of what's going on with the patient and with the body. So showing well-roundedness in terms of your extracurricular activities, volunteering, interest um, in people and their quality of life, because urology is very much a quality of life specialty where
Hmm.
we're not necessarily saving patient lives on a day-to-day basis, at least not in the acute sense. But we are doing our absolute best to guarantee patients have a good quality of life, because regardless of the urologic issue, whether it's preserving their kidney function because of obstruction and keeping them off dialysis, or helping them with their prostate issues so they're not waking up 5 6 times in the middle of the night to urinate and not getting any rest,
Hmm.
or
Yeah.
congenital problems with kids, um, or bedwetting in kids, or whatever is the problem that we're dealing with. It can definitely have a huge impact in their quality of life.
Hmm.
And so showing that you're interested in helping people live the best quality of their lives
Yeah.
is really meaningful.
Oh, okay. Awesome for that. And then on the top of the applicants, urology has it seems like it has a low percentage of female urologists currently. Can you touch base on how we can improve the diversity of urologists?
Yeah, I think that it's pretty remarkable the shift in the field, and I feel like there's definitely a groundswell of interest from a very wide, diverse variety of applicants these days, which is so amazing
Hmm.
because 30, 40, or even less 10, 20 years ago, the applicants were not also diverse, and so the practicing urology community is not as diverse as it could be. And I think that's slowly changing. And I think that the wide variety of urology and the fact that there's something in it for everybody is really helpful,
Hmm.
because you know different strokes for different folks, and some people are interested in um, helping old men and their urologic problems. Some
Hmm.
people are interested in helping young men, young women, and their urinary complaints. Some people are interested in helping kids and their uh, genital urinary complaints. And so the fact that it's such a diverse field, I think, helps increase that interest amongst a wide variety of applicants. I think that's great for the field.
Okay, yeah, awesome. Thank you for that. And on the topic of being a urologist, what do you find is the most exciting aspect of being a urologist?
I think the most exciting thing is getting to do, cool surgeries that are very impactful on quality of life.
Hmm.
So, as a pediatric urologist, um, we do, a lot of bread and butter small procedures from congenital problems with the genitalia, like undescended testicles or hypospadias or other penile conditions, and then problems with the bladder and ureter and kidneys.
Hmm.
And the surgeries are often relatively quick. Uh, Generally, um, most of the surgeries we do are outpatient. They generally require 1 to 2 pre-op visits, where we may try some medical treatment that may fail. Um, uh, you know, Book them for surgery, which is generally outpatient, unless it's a reconstructive surgery where they might spend one night at the hospital,
Hmm.
and then you see them back in clinic a couple of weeks later, and they're back to their active, uh, you know, getting into trouble selves. I was telling the parents of my patients that your active kid is generally a healthy kid. So as much as a parent, it's always stressful when your kids getting jumping around and getting into everything they shouldn't get into. It's at least it's a sign that they're doing well.
Yeah.
So so that's what I like, is that you generally have uh, generally limited uh, course of interaction with a patient, but you get to do a surgery that has a real meaningful impact on their quality of life, and then you can see them doing much better. So I think that definitely appeals to me. There's others, not that all patients are like that. We have our urologic long-term patients that are born with issues that lend to urologic issues, such as uh, spina bifida patients that have neurogenic bladder. Those are going to be your lifelong patients that you're going to have to transition to a transitional um, or adult urologist when they're 20s, for example.
Mm.
And so those are patients you're going to see frequently throughout the course of their childhood and adolescence. Um, and so that you also develop relationships with those patients, and they're kind of like your long-term um, patients. So that also appeals to me,
Mm.
that you're really making an impact and you get to see them frequently and get to reassess them at frequent intervals.
That's kind of cool that you're able to have some short-term interactions, and then you also have the long-term interactions as well.
Yes.
Okay. On the other side of the spectrum, what are some of the most frustrating aspects of being a urologist that students should know?
So everything has its pros and cons.
Mhm.
So one of like I said, the pro is that you're kind of a jack of all trades, but the con of that is that you're a master of none.
Mm,
So it's not necessarily a con, but you may do so many different kinds of procedures or do so many different, techniques, instruments, robot, endoscope. So sometimes you do cases that you do bread and butter that you do several of these a week, and then there's going to be the cases that you do every 6 months.
mm,
And so every time it feels like every time you do this case, it's like the first time you're doing it. Uh,
mm,
it's hard to get into those groups, so you always have to be brushing up on your skills, um,
mm,
practicing your skills, staying up keeping up with the literature on the latest things. Um, because being a urologist, I think, makes it hard to become complacent. Um,
mm,
and then you also, I think of this as a pro, but you're never kind of a team of one.
mm,
It's a very multidisciplinary. So, like I said, you need to be very familiar with the milieu of the patient, but you're not going to be able to manage the patient without the help of your internal medicine colleagues and your nephrology colleagues,
mhm,
your other surgical specialists, etc. So, and your nurse practitioners and advanced practice providers that do a lot of the, like I said, for chronic patients, a lot of their visits are going to be with a advanced practice provider to teach them how to catheterize themselves, to spend time with them and figure out what their concerns are and educating them. So those it's definitely a team effort. So you don't necessarily, you know um, you're not necessarily running the show. You're a team member,
mm.
which can lend to some frustration as a surgeon that likes to cut things and fix things.
Yeah.
It's not quite as cut and dry. No pun intended, because it's always wet in urology.
Yeah.
It's not quite as cut and dry as some other surgical specialties where you're fixing a bone and then you're done, and then you determine everything, because you have to really work with your medical colleagues to determine appropriate patient selection, appropriate pre-op optimization, appropriate post-operative care,
Hmm.
um, etc. So you're really just part of the team.
Cool. I like how you translate some of the cons into actually
Yeah,
pros.
yeah.
That's I like that aspect. Sorry, I have a little cough.
No
It's
worries.
not COVID though. Uh, you mentioned advanced practice providers or mid levels working with them. Do you see the roles changing in the future?
Um, I think that there definitely is a role that's expanding,
Hmm.
um, and there's plenty of um, work for urologists. And I think it's hard for us to do our jobs without their support. And I think some of that support can be uh, increased a little bit in terms of doing office procedures, um, you know, in the operating room, seeing patients, etc. So I think there's definitely an increasing role. I think as a surgical subspecialty, will always uh, control the reins of that.
Mm,
It's not like they're taking away uh, volumes from us or procedures from us. These are
mm,
really procedures that we really need help to get. For every, not my specialty again, but for every bladder cancer diagnosis, you know, you may get a surgery out of it, but that patient's going to have, cystoscopies in the clinic every 3 months.
mm,
So, unless your schedule is set up where you can do, 12 cystoscopies in clinic for every one bladder surgery you do, or some ratio like that, uh, you need help,
mm,
and so in academic institutions, it may be residents, it may be fellows, but in the private practice world, you may see more advanced practice providers doing office procedures that are just helping really you with the flow of your patients, because you need a lot of that stuff taken care of so you can do the juicy stuff. Uh,
Mm,
so I think, at my current institution, we don't have residents, we don't have fellows. So we're training the nurse practitioners to do circumcisions in the
mm,
clinic, uh, because um, I end up with a lot of circumcision referrals on my
mhm.
referral queue. And I mean, let's face it. I mean, and currently I'm the only pediatric urologist in like 5 counties,
Oh
right?
wow.
So I can't do all the
Yeah.
circumcisions that were not done at the hospital, or that the pediatricians, weren't comfortable with the weight of the patient, etc.
Mm,
I'd much rather be doing kidney surgeries, right?
mhm,
Um, that's what I trained to do. That's what I love to do. And the circumcisions are fine and they're an easy procedure. And if I have an opening in my clinic, yeah, let's fill it up with circumcisions. But if I needed to do all those myself, I wouldn't have time to do the stuff that I really want to do. I wouldn't be able to do the kidney, ureter, bladder surgeries and the genital urinary things.
mm,
So having the nurse practitioners, trained to do those circumcisions in the clinic with me to back them up when they need it, just helps offset um, a lot of patient load that I just don't have time to get to. So I think there is definitely a room for expanding the role of advanced practice providers in urology, and as a surgical specialty, we'll always control the reins of that.
mm,
But we can definitely train them and oversee them in providing good uh, patient care,
mhm,
including procedures.
mm. Okay. Awesome. Thank you for that. And how I guess it sounds like the job market for current students who wants to go into urology is pretty good in say 5 to 10 years down the road.
I don't really know. I'm not the best person to ask about that. I mean,
Okay.
pediatric is very very niche. So
Okay.
there's something like 300 to 500 practicing pediatric urologists
Mm,
in the whole country, and it's a very niche specialty.
mm-hmm,
Uh, that being said, I don't think there's a job market problem
mm-hmm,
in any of the urologic um, subspecialties.
mm,
There's definitely a growing need, and there'll always, I think we're churning them out, residents and fellows out enough to meet that need.
mm-hmm.
Um, but
Okay.
there's definitely a growing need as the country gets, most urology, like I said, deals with the urologic problems of the elderly, and as the country ages and gets older, there's going to be a lot more
Mm,
of that necessary. We're also a young country with a lot of young families, and that's what keeps me in business. So
mm. Yeah, yeah.
uh,
Yeah.
people
Yeah.
and kids.
Urology is known as one of the, I guess, like a lifestyle specialty.
Yeah.
Can you discuss with us regarding like a work-life kind of integration as a urologist?
Yeah, I think that it lends itself to being a lifestyle type specialty because it's procedural, so it's generally well immersed.
Mhm,
It's usually elective procedures, so we're not generally doing surgery on the critically ill or have a lot of emergencies in the middle of the night. So our workload is more well planned and
mm,
not being on call is not so burdensome. Um, and so those things make it for a relatively um, good lifestyle choice for physicians. And I think that people are, uh, as in medicine in general, I think we're valuing the the well-rounded lives of our physicians a lot more. And
mm,
people going into medicine now don't want to define themselves just by what they do uh, at work.
mhm,
And so I think people are coming to realize that all specialties um, need to have a much more reasonable path towards training
mhm,
in terms of duty hours and taking care of themselves and their families, and a much more uh, tolerable work environment and work hours. So I think and I think that urology lends itself pretty well with that. But like any specialty, you within urology, like I said, there's such a wide variety of things that um, if you want to take care of the most complex cancers or the most complex reconstructive and trauma patients, you can do that. And you want to take care of the more elective infertility issues, uh, female urology issues, pediatric urology. There's a lot of these niches within urology that are much more lifestyle friendly.
Mm.
So you pick your poison.
Yeah, yeah, awesome. Thank you. And how do you see urology changing down the road, 10 to 20 years from now?
I think that with any surgical specialty, I think that we're going to look back at what we did 20 years from now and think it's a little bit barbaric.
Hmm.
As things become much more minimally invasive, as we find non-invasive treatments for some things that all patients used to have surgery for, and I think that has been happening and continues to happen. Um, so there's there are conditions where uh, the trend was to operate on every child that had vesicoureteral reflux,
Hmm.
and now we're a much more selective and stratify them to see if that's actually going to impact their kidney function long term and lead to renal scarring, or if putting them on preventative antibiotics will prevent that until they outgrow it and waiting it out. And now we're much more selective, and now we also have more minimally invasive techniques to fix the same problem. So not all, even if they do require an intervention,
Hmm.
it could be an endoscopic intervention, it could be a minimally invasive like laparoscopic intervention, or it could be an open surgical intervention. So before, 100% of patients needed an open surgery. Now that percentage is much lower as we're waiting patients to
Yeah.
outgrow the condition, uh, or offering them non-invasive or minimally invasive procedures. So I think as that trend continues, I think we'll look back and say, wow, we used to cut everybody open
Hmm.
from to fix this problem, and now we're realizing that not everybody needs quite that aggressive approach like that. So I think that the trend towards um, uh, watchful waiting or medical management of patients continues to grow in all fields of urology,
Mm.
um, including my own pediatric urology, as we refine minimally invasive techniques with robotic surgery, endoscopic procedures, etc. Um, and as our surgical techniques become more refined, then some of the old techniques become a little bit outdated, and they still have their place, but at least the numbers of patients that are subjected to that are much more well selected.
Mm. Okay, awesome. So it's possibly trending toward more medical management and then
And more minimally invasive
invasive.
techniques. Yeah.
Okay. And what additional helpful resources that you recommend for students who are interested in seeing if urology is a good fit for them?
Yeah, so the American Urologic Association, the AUA, is a great resource. Their website has a medical student curriculum
Mm.
for students that are, for example, rotating on urology rotations, things that they should kind of learn as they go through their rotation. And so that's something that you can kind of look at even before start, and kind of get to see to learn what are the basic conditions that a urologist treats and how they're treated,
Mm.
um, before, during, and after a urology rotation.
Mm-hmm.
Um, and then I think your YouTube and other like your channel and other channels are a great resource
Mm-hmm.
for med students to just kind of get an idea and get this see somebody speak about their field or watch the surgeries now. I mean, you can see, so you basically every single procedure that I might do or another urologist might do is somewhere on YouTube.
Mm.
So you get to see the procedures that you
Yeah.
get to do. And I think they're all pretty fun, cool. So if you think they're fun and cool, urology might be for you.
Cool, awesome. And my last question is, if you have any, and you've given a lot of great tips and advices already to me and the students. Do you have any top tips personally to give to students, and also any additional things that you like to add that I miss asking?
Um, yeah, one thing to always be cognizant of is that, like in something like urology, it's a small world. So
Mhm.
everybody you interact with, whether that's on a rotation or somebody you consult for in the hospital or whatever, it's a small world. So kind of network, make friends with, be super professional, be super courteous with everybody you interact with, because those will be your colleagues and for the rest of life. And so the vast majority of them, when you're training, you'll never interact with again. But there may be a few that you run into later in your career, um, even if you go into private practice or move across the country. So always be cognizant of that. That everybody you deal with, interact with, are colleagues and future colleagues, and use that to your advantage and network and get to know people,
Mhm.
and also make sure not to burn any bridges as you go along.
Yeah, I think those are very great tips. Thank you, AR, for your time and energy, and I think this conversation is very helpful for students to learn about urology.
Awesome.
All right, so I appreciate you doing this for us.
Not at all. It's been a pleasure. Thank you so much.
All right, thank you.